maternal health, the safe maternal and newborn care in the country. It's a pertinent discussion, and earlier on we were deliberating on matters to do with the health and safety in terms of various aspects to it. So we'll continue with this. I'm joined by Winnie Kubai right here in studio. She's a pediatric nurse, and Dr. Gitinjali Patil, who's a consultant obstetrician and gynecologist. Daktari, I'd like to begin with you on this particular point. I've heard of a term, surrogate mothers. How exactly does this go about? And perhaps what necessitates such a decision? And is there any risk in terms of the maternal health care along that line?
Okay, so surrogate mothers, they are usually the ladies who are carrying the pregnancy for somebody else, who are not able to carry pregnancy for themselves. Like, for example, some mothers who have gone hysterectomy for some reasons, like somebody who has extreme bleeding during delivery. We do obstetric hysterectomy. They are not left with a womb, so they end up using surrogate mother. Another reason could be hysterectomy for large fibroids, or some mothers who are born without a womb, some congenital anomalies called Mullerian anomalies. They are born without a womb. They can opt to go for surrogate mothers. So this procedure is done through IVF, wherein the eggs and sperms are fused, and then they are transferred in a surrogate womb so that this mother carries the baby, and she requires the same type of health care as needed by other mothers. All the thorough checkup for all 9 months and a safe delivery of the child. We are not very sure of the surrogacy law as for now in Kenya. The commercial surrogacy is not yet approved.
Okay, thanks for that clarification in terms of the law. Back to you, Nas Kubai. When we talk about safe abortions, kindly approach it from the law aspect, what the law says, and what happens if a mother's life is threatened by the fact that she is pregnant. Does this necessitate a safe abortion? It's a dicey affair, so talk to us about this.
No, when you give it the prefix safe, of course you're talking about the accepted abortion.
Yeah.
And like you said, when a mother's life is in danger, and this danger is caused by the pregnancy, then the doctors are left with no other option than remove the danger from the mother, just to save the life of the mother. The biggest cause of such abortions or such removal of the fetus is the hypertensive diseases in pregnancy. Some are associated directly to the fetus and the placenta. Okay. And until we remove the fetus or the placenta, then the mother may not survive. There could be other problems which can actually cause the fetus to be removed, including latest, we have issues of COVID. We have had several cases where the fetus had to be removed just because the oxygen demands are too much increased, and now the mother's life becomes endangered because the infant or the fetus in there needs to take all they need. That's one funny thing that God made. The fetus takes all that they need from the mother, like they don't consider what will happen to the mother. So when the ventilation demands or the oxygen demands surpass the ability to supply, and the mother's life is at risk, then there's no other option than to get the baby out, just so that we can save the life of the mother. Otherwise, these are the backstreet abortions for no medical reasons are actually another biggest problems in our maternal mortalities. Yeah, they've contributed to issues of either maternal death or maternal illnesses, including infections that have actually made some of our teenagers go all the way to lose their uterus or even become barren, like long term.
Okay, well noted. Daktari, I'd like you to add your voice to this because perhaps you've come across such cases, the safe abortions route vis-a-vis the back route abortion. And I think information is power at the end of the day. We need to necessitate not just the youthful population, but those who are not informed about the dangers that might come along with backstreet abortions vis-a-vis the safety measures that are needed in order to do a safe abortion? Kindly shed more light on this.
As Ms. Winnie has already mentioned, these abortions we are doing especially for hypertensive mothers. It is
Okay, we seem to have a challenge with Daktari right there. We'll establish the connection, but I think she was sort of belaboring the same point as you were. You mentioned something earlier on, Kubai, about the breast milk bank. Well, what's the status so far? Because I think last year we carried a story, or recently we carried a story on a breast milk bank that has been established. Is there a process, is it still ongoing, and what benefits has it reaped so far?
I may not have the data of the benefits so far,
yeah.
but I know it's, you see, it's something that came in, and it's not easy to sell it to the mothers. So until we have maybe this one-on-one conversation with the mothers whose babies really require breast milk, but we have, like you said, we have mothers who even have lost their newborns at birth for several reasons. There are other mothers who have a lot of milk that they can donate. So the milk undergoes screening. We have a bank at Pumwani at the moment. The milk undergoes screening so that it is safe for the baby. Because breast milk in its nature can be stored even for up to 6 months. So with the correct screening, correct storage, the breast milk is able to retain its contents without being a danger to the newborn.
Okay.
So the uptake, I may not have the data currently.
No problem.
Sure.
Let's not confuse our audience with no facts at all. So, Winnie, as we continue with this conversation, we talked earlier about CSs, and there are a couple of narratives that come out from CSs. How many kids can you get if you choose the cesarean section alternative? Is there a cap in terms of the number of kids you can get? And perhaps right after getting a cesarean section, is there an amount of time you should stay without getting a kid right after in order to leave the wound to heal? Talk to us about these details.
So again, this depends with several factors. One, we look at the reason for the initial cesarean section. If the uterus had suffered some trauma, then it may not be safe to get pregnant again sooner. And we've been asking mothers, depending on what reason, they could take even up to 1 year.
Yeah.
If probably the mother had the cesarean section and they lost their baby, then and they would want to get pregnant sooner, then that's an option they can choose and walk the path with their gynecologist so that they undergo through this evaluation to be told now you're free or you're safe to get pregnant. But generally, there should be time. Once one gets pregnant, there are some pregnancy hormones which alter like everything in the reproductive system.
Yeah.
And when the individual gets pregnant again very soon, the body may not be ready to, or the hormones may not have stabilized enough to retain the pregnancy, and the body may actually get rid of that pregnancy. So to avoid these unwanted, or do we call them, these unnecessary abortions, because abortion is not actually removing the baby by yourself. When the baby starts coming out by itself, it's actually called abortion. So to prevent such incidences, then we encourage the mother, the minimum they can take to allow the pregnancy hormones to settle and the body to get back to the pre-pregnancy state would be up to 3 months.
Okay.
But then you're looking at a mother with a scar, a mother whose minerals like calcium, iron had been taken a lot by the baby, then you'd want to have them nutritionally stable. When you talk about hormones, we talk it endocrine, we call it endocrine. So we want them to have a stability so that they can get pregnant again. And also, like I said, look at the reason for the scar. You asked about the number of babies one can get.
Yeah.
When I was in school, we used to talk about 3. You get 1 scar, take at least 1 year, get another baby, and the third. During the third scar, I would used to see the doctors actually encourage the mother to undergo a permanent family planning method. But that is now no longer in here. We are looking at the mother as an individual so that we allow them to get some are getting even up to 4 and 5 babies, and they're safe. But this cannot be a general method. It's actually individualized.
Individualized, depends with an individual. Okay,
True.
Daktari, I believe you're back with us. Perhaps as you finish up on the point you're delivering earlier in terms of safe abortions and whatnot, I've equally heard of a narrative like called Stitch. I don't know if I'm saying it correctly, in terms of a mother who's not able to carry the full pregnancy, all the 9 months. Is this where the Stitch comes in? And perhaps highlight more information about this.
Yes. I hope I'm audible now. I was adding to some points for safe abortions where we can do it. So along with hypertension, there can be a decompensated heart disease, or there may be some anomalies in the baby which are diagnosed early. So we can do the termination so that the mother does not carry the pregnancy for all 9 months. Like if we diagnose a baby to have Down syndrome or some complex to put is about the McDonald's stitch, where the mothers are not able to carry the pregnancy up to all 9 months because of some cervical incompetence. So in those cases, we are putting this stitch at around 13 to 14 weeks of pregnancy, that is in the early second trimester, so that now the pregnancy could be carried up to all 9 months, reducing the risk of miscarriages.
Okay, thanks for that clarification, and apologies about the network issue. But back to you, Nas. Now the maternity and paternity leave issue. Do you believe there should be an extension, especially for the paternity side? Because we hear the fathers complaining time and time again that, is it 14 weeks, 14 days? I mean, what's the current timeline right now?
It's been 10 days.
It's been 10 days, actually. True. So is this enough, especially when it comes to the fathers, because we know the mothers usually get a longer time? What's your take on the maternity and paternity leave question?
So allow me to ignore the economic aspect of it and talk about the health implication part of it.
Yes.
So if I were the one giving this option, I would ask that the paternity leave have some extra days. This is because during pregnancy and during childbirth and immediately after, there are several factors that will determine the health of the mother and the health of the infant. One of the biggest factors is the presence of the pregnancy hormones, their departure and entry of the lactating hormones, which usually, do I call it, tamper with the psychological well-being of the mother, so that we have the mothers getting what we call the postnatal blues, which are different for different people depending on the kind of the amount of support they had pre-pregnancy, during pregnancy, childbirth, or any harmful experiences that they went through. So if the pregnancy has been uneventful, the mother may suffer these blues for between day 3 to 7, while others suffer all the way to even up to 2 weeks. So the presence of the father really matters, because it's the bonding. The hormones usually push the mothers to want this kind of attention that the fathers will not give when they're away. Secondly, when talking about production of breast milk, it takes not only the presence of the breast and the milk-producing cells, but also our biggest part of it is determined or influenced by the mind or the psychological status at that moment. At times, all a mother needs is the presence of the father to tell her, it is well, take care of our baby. Just that is enough to bring the letdown of the milk. Sometimes we go to the extent of asking the fathers to pat on between the shoulder blades of the mother, and that also promotes the letdown of the milk. So when you're talking about 10 days and then the father goes away, I think we are not being fair. If you were to be just to all the mothers, then I think I would ask for an extension of the same.
Okay, and we're actually pushing for men to take care of the kids and the mother, not to go in pubs and celebrate the kids during this paternity break. But at the end of the day, you've talked about the presence of the father. So single mothers, where does this leave them?
Too bad. What I would ask is that the single mothers, for the families who have these single mothers, please be there for them. And I'm a product of a teenage pregnancy, and it wasn't easy because the family thinks that you did something wrong. So all the way from conception to birth, the support is, or the words that you get from the family are really not pleasant at all. So when you give birth, they want you to take care of your own problem, and that contributes actually very much. If I were to do, to take statistics, I will tell you we have a lot of single parents being in hospital with their neonates because, one, they lacked to breastfeed enough. The neonates suffered all those problems associated with lack of breastfeeding. It is a topic that we can discuss and we can't finish in a day. Okay. Some of them suffered low blood sugars, which damaged their brain, so they come with deficits, developmental deficits, that is. Others will even come with kidney injuries because there was no milk let down, the kidney didn't have anything to filter. So they are sent from all over to come, and we actually have to do an operation on them, to do a dialysis on a 3-day-old, 7-day-old, because they did not breastfeed. So what I can urge the public is, now that the pregnancy is here, let's carry it with our family member to the end, so that the aspect of singlehood will come at least 60 days after this baby is into the world. Right. Because then we are reducing the problems that come within the first 30 days, within the first 60 days. Once the mother gets strong, from 60 days onwards, they can be able to take care of now the other problems associated with infant problems all the way.
Okay, thanks for that clarification. Dr. Patil, let's talk about the health aspect, not the financial aspect, of course. Is there a point where you say it's too much in terms of getting kids? Because there are cultures that believe a child is a sign of wealth, abundance, a sign of abundance. So family planning might not necessarily apply in that particular scenario. So health-wise, is there a limit where you say enough is enough, especially when you're looking at the mother's health? Well, what's your take on this?
Size it.
Okay, we still have
a lot of... Hello?
Yeah, kindly continue. Continue?
Yeah.
Okay, that's a small challenge right there. Apologies for that, but we still have a nurse on this side of the studio. Well, what's your take on that? That same question. Is there a limit? Is there a point you say enough is enough, especially when you take a look at the mother's health?
No, the question has been answered by yourself. Depends on the mother's health.
Depends on the at the
depends
end of
on the mother's health.
Okay.
There can never be too many babies. We look at two things: the social aspect, economic aspect, and the health aspect. So if the mother is healthy, we've seen them and they survive. The only problem is if the mother continues giving birth as they age, then there are chances of giving birth to children with some congenital problems, because as we age, as our cells age, even the eggs that are supposed to be fertilized and make a baby actually age. You'd be surprised if I tell you, when the fetus is forming inside the uterus, a female fetus, they actually form all their eggs at that particular time. So by the time they get to be born, they get to become teenagers, they start being mothers, that egg has actually aged a lot. And in that case, there could be chances of, do we call it mutating, or the eggs getting problems. So the only then limitation would be giving birth to children with problems, and that contributes to a lot of other problems because the mother could become economically grounded. Sometimes they spend a lot of time in the hospital. They even become socially alienated because of the kind, it's not a pleasant view when we have those children with some weird formations. Otherwise, let people give birth if they can. Let people plan for the number of children they're able to.
So in one or the other, you sort of substantiated that narrative we get, hey, my body clock is running, I can't wait forever to get children. That's what a narrative at times that we get from the ladies. So Dr. Patil, as we finish, I hope the network is great right now. As a footnote, as we finalize on this whole conversation, we've talked of safety before, during pregnancy, and even after. And we talk about after. I hear of the kangaroo system of actually taking care of kids. Perhaps you can shed more light on this as you give your final remarks, Daktari.
Newborn.
Okay, and apologies for that technical challenges, and at times it's the order of the day, but we do appreciate your input as well, Daktari. Dr. Gitanjali Parag Patil, who's a consultant obstetrician and gynecologist. We were also joined by Winnie Kubai, who's a pediatric nurse. Thank you so much for your time. I think I'll ask questions next time from a more informed point. Asante sana.